I'm presently working in a community health center in the city of Chicago. And I encounter patients every single day who just absolutely cannot afford health care. One of the stories that I recall is a female who was between the ages of 59 and 65, too young for Medicare, but unemployed, so unable to attain and pay for her own insurance, who had a coronary artery disease, which resulted in a massive heart attack. What could have prevented that was screenings that were done perhaps free for cholesterol or for her blood pressure, and medication, which she could not afford, which would have controlled the coronary artery disease, the high blood pressure, and the hyperlipidemia, which all resulted in her fatality. And we could expand those programs, pull in perhaps or add on a program that would keep the people who are caught in those gaps, people who are too young for Medicare, people who, children who are in college who can't get insurance, and then people who are self-employed who can't afford the insurance, and then others who perhaps are caught up in that whole dilemma. If we could actually expand the programs to include those people, they work. The other very important thing is to pay for screenings, because the screenings are preventive and it's the right thing to do. And when you do the right thing, it always costs less in the long run. If you prevent a calamity, then you don't have to pay for it later on.
My name is Leslie Ramirez, and I'm a general internist in Chicago, Illinois. I work at a large hospital-owned practice, and I would say most of my patients have some sort of insurance. I created a website about 6 months ago because I felt that there was a need to help patients who had either no insurance, or like many of my patients, they have insurance, but it just doesn't cover very much. I was inspired by a handful of patients. Well, I use these as examples because they really represent many others. The first patient that comes to mind, my patient Deborah, I will call her, and she was on about 4 different blood pressure medicines, and yet her blood pressure was very poorly controlled. It's about 180 over 110. I mean, she could have had a stroke easily. There was only one medicine left that I could think of that might lower her pressure. So I gave her a prescription for this and asked her to come back in a few days. She came back in a few days and her blood pressure was unchanged. And I asked her if she had started the medicine, and she said no. That medicine was going to be $100 and her family just couldn't afford it. This patient is my mother. She lost her job, and she at the time she was 62 years old, so she's not eligible for Medicare. She had no insurance. And over dinner one evening she said, well, I've come up with a great strategy on how to save money. Since I don't have insurance, I'm just going to not get my mammogram this year. As her daughter, I thought, this is crazy. This is crazy that people, they decide, whether to eat or get a potentially life-saving test. So I explained to her that she did not need to forego her mammogram, that mammogram prices vary. We could find her an affordable one. In fact, we found her a free one. But she didn't know about it. She didn't know that was even an option. I created Leslie's List as sort of a survival kit for people who have to pay out of pocket for their health care. And I know the number 47 million gets batted around because that's the number of uninsured, but people who are underinsured, I don't know the exact number, but I think it's got to be at least as many. Anyway, these are people with high deductibles who end up having to pay themselves. It lists the price that you pay out of pocket for medicines. We have over 500 medicines listed, and we have the price for at 7 different major retail pharmacies. We also include the prices for testing, such as we also have a comprehensive list of the free clinics and services offered in our Chicago area. We have about 240 clinics listed. I think our current system is cruel, immoral even. I'm well insured, but I can't believe that we are treating each other, our brothers and sisters and mothers and friends, like this. I mean, just the thought of losing your job means losing your health care, and you just get this double-barreled whammy. It's just, how did we even invent that? I really don't think that we are a cruel nation. I think we're really kind and wonderful and giving people. I just think we somehow got ourselves into this crazy system of health insurance, and now we owe it to each other to fix it.